What's the first thing I need to do when I come into the room?
Wash your hands.
If I have access to the sink, yes, but then at the very least, sanitizer. Okay? Then, what would be the next thing?
Table, sanitize.
Well, that should already be done. Yeah, we already want that done. Huh?
Below.
Sheet.
Yes, well, the bolster. No,
Bolster, yes.
pillow,
and
close.
pillow.
We'd want the tube and the pillow already placed underneath, and then let's see, feet up, right here. Then I can see where the bolster is relative to the calcaneus, knees, lumbar spine, thoracic spine, well, sacrum, thoracic spine, lumbar spine.
This is just the first contact, yeah?
Yes.
This connection.
Yes.
Or connection.
Yeah, and you don't have to do it this way. This is just my pattern of initially making contact over the sheet, working my way up. I think a little bit about chakras with stuff like this, but whatever. Now, a general rule should be contact the area you're about to massage and then undrape it. Over the sheet and then undrape. Bunchy bunch bunch. And then I'm going to confirm, can client bring their arms over to the side? That's comfortable. Up over the table, comfortable. Good. Okay, same thing over here. Off to the side, good. Up over, good. That as an assessment works great for just confirming that there's not anything too bad going on with the shoulder joints and scapulas. Here, we can place your hands there. All right. Now my pattern, I think, started on the left side. So here we go. Initially, I'm just going to make contact, similar to how I did over the sheet, but although I'm all in clothing, I'm going to be talking about what I would be doing with like the skin and superficial fascia. So here, just kind of be moving the skin, using hands, just kind of moving, making something. I will be assessing and be thinking very profoundly, but right now, just think, you know, it's just nice, gentle, compassionate touch. Okay? I'm warming everything up. I move the skin in several directions, warmed up that first layer. Then I apply lotion and go in for the first cycle. First layer of pressure, and then you would graduate pressure. But to expedite this, I'm going to keep it a little bit at a faster pace. So instead of like 3 or 4 applications, I'm just going to be doing like maybe 2. Okay? All right. Finding here's the ribs. Here's the top of the pelvis, the iliac crest. There's the sacrum. So finding the sacrum is how I kind of approximate where everything is. Come here. There's the lower ribs. There's the floating ribs right here. And I glide towards the pelvis. I find the top of the iliac crest. I kind of adjust my pressure. And I follow the line of that rounded bevel of the iliac crest. So I glide down towards the sacrum, and then I go across towards the spine. On an angle towards the sacrum, down towards the spine. Take a step towards the head, on the ribs, down, across, down, across. Another step, switch arms, kind of take the arm, bring it to the side, pin there, and then more, my elbow flexed more, going to be on upper trap, levator scap. If I take a step closer and flatten my arm, then I'll be on rhomboids and more of the trapezius. Middle trap, upper trap, levator scap, rhomboids, middle trap. This doesn't have to always, even with lotion, this doesn't have to be turned into big glides. This could be here, that's a glide. Then here, that's a glide. I can make this rhythm of compression be part of the flow. Not everything has to be turned into a big swoopy action, okay? And I'm right here. Rhythmic compressions. This hand's just kind of stabilizing. If I wanted to use a forearm, could do that too. Okay, reposition the arm. Towel a little bit away. Here we go. Kind of moving the skin. I stabilize under the elbow. You don't have to do this way, but this is the way I tend to, just so I can control the arm. And forearm on the anterior side of the forearm. That's going with the bones of the skeleton. There you're seeing a glide naturally just happen on its own. And then a push plus a pull. That's our kneading. But the kneads don't have to be fast. Slow everything way down. It's like learning how to play music or do a dance. You got to do the steps and the actions really slow. Anybody that plays music, like you got to know what a whole note is before you can do a 64th note, okay? Slow it down. Okay. Parlor trick. Open the fingers, close the fingers. So I use this to open the fingers to place my soft fist. Then I cradle the thumb. Rhythmic compressions, not twisting at my wrist. Rhythmic compressions, rhythmic compression, rhythmic compression. Then I'm going to turn, be in line with the fingers, which will put me in line with the metacarpals, and do that all again. Working my way steadily out towards the 5th metacarpal and phalange, i.e. the pinky finger. And done. Arm can be wherever it's comfortable. I swoop around. This is my personal favorite for like how I get to the other side of the table. So I grab a hold of the traps. See how when I walked around, just here, I just bring my hand up, contact that upper trap, and get a hold, both hands, nice pull. You gotta learn the power of the sloth claw. Where my fingers are too flat, then I'll just, so I gotta have a curl to them. But I don't want to curl so far over, I can't be like this, I'm gonna get her in the neck. There. You feel like you're just on the upper trap. You know, you kind of squeeze a person's upper trap. I want to be hooked on that, not over on their neck, okay?
That's right above like the clavicle area, right?
Yeah,
Right
just
there.
posterior. You want to be, you don't want to be over on the clavicle.
Right.
So way back here. I can do this. It's a nice way to change up how I use my body. So it feels good. I can kind of get a nice stretch. So further back, yeah. Probably still even further back. There you go. Good. Now I'm standing here to do it all over again. Move the skin. All right. Come in on an angle towards the sacrum, across towards the spine. On an angle towards the sacrum, across towards the spine. Take a step towards the head. On an angle, across. On an angle, across. Switch arms. Bring the arm over. Okay. Bend my elbow more, or flex it. Get that upper trap spot here. Just do a few rounds like that. And work my way inferiorly or downward, or in the rhomboid middle trap area between the scapula and the spine. See, this is where I'm not forcing a glide like this. I'm doing kind of rhythmic compressions, not breaking contact. If you see my feet, taking steps with every single one of those little pushes so that my shoulder's staying exactly in the same orientation. Okay. Push, push. Across the bone. Then, little rotations. If I had to do more, then it's with the bone. Okay, arm up onto the table. Moving everything. Cradling the elbow. Forearm right on their forearm. And down towards the wrist. Don't apply pressure too close to the wrist. Okay. Then push, pull. Push, pull. Push, pull. Push, pull. Opening the hand, soft fist. There we go. Okay. Arm wherever it's comfortable. Redrape. You could have always redraped the back there and just done the arms too. Okay, and I swoop around. Get this trap. You'll see how I'm using my legs. Like I'm not like this. Drop into your knees. Find a thing. Oh, that's something. And hold there. This is where I get that kind of this thing that people want. This is way better, I promise you. Okay. And we're here. Using kind of this rhythmic rocking, because you'll see a lot of my actions cause this kind of rhythm. You gotta be careful.
You know what? I think that actually feels so good. I'm just like, yeah, the whole thing was just great.
You see how incorporating a little bit of this rhythmic rocking helps create a continuity? It doesn't make you have to be overly graceful, right? It's right here. Like it feels like I'm doing something, even though I might be just trying to figure out what do I do next, right? So, heel squeeze. If anything, squeeze a heel, massage a foot, and think about what you're trying to accomplish. So here, okay, finding the sacrum. So I can't do this wrong if I do it like this. This hand holding the ankle, this hand identifying the sacrum and the top of the iliac crest. Really shouldn't say that. The iliac crest is like the top. So anyway, here, there. I'm going to just rotate the hip this way into external rotation. External rotation. I'm going to drop my elbow. More lateral. External rotation. Again, for gluteus maximus and gluteus medius. I can feel the greater trochanter is right there. I want my forearm to be right, kind of in line with the femur, because that's what becomes that bone.
Is that sometimes where like the little dip is, like right here?
Yes.
For like women especially?
Yep, you'll see the dip here, and then this is where like kind of the bow out is. So there kind of be like a little dip here. The hip joint, a bump, a dip, another bump, and a dip. But if you see like how people will draw it, they'll turn that all into one arc, right? So I get my hand kind of I get my forearm lined up a little bit with the femur. And we're right here. Deep lateral hip rotators, including piriformis. And I'm going to pull the hip just a little bit into internal rotation. That will gap the space, create a stretch on those muscles. Okay. Leg down. Drape a bit more precisely. Make sure there's a good bunch between the legs. I'm only worried about this lower section of the hamstrings. Okay, on an angle, across. On an angle, across. Same thing for the calves. Think gastrocnemius. That's the one you're really initially palpating. Gastrocnemius. Okay, on an angle, cross. I tend to have this hand hold that and stabilize it so it's kind of getting sandwiched as opposed to this, where it just will roll away from me. And you can do some knees, push, pull, push, pull, push, pull, push, pull. Heel squeeze. I was going to do anything more. Heel squeeze, grab the metatarsal, the first metatarsal, the big toe, push, pull. And I kind of squeeze both sides of the foot, work my way around. If I wanted to, I could do more here, but sometimes you're reaching. So if you're reaching too much, don't do this one. Push, pull. Kind of a nice way to just get around to the other side of the table. All right. Then all over again. Whoop. Okay. Here, here. Sacrum. Thinking gluteus maximus. Check my elbow more laterally. Thinking gluteus medius. Forearm more in line with the femur. And as I roll this back and forth, I could be applying real light pressure and be feeling for that greater trochanter as I roll it around. And then I can orient my arm accordingly. So I can kind of just be resting my arm on the outside of the leg, roll that around and go, okay, there it is. All right, that's where I need to be.
Are you adding more bend to the knee at all? While you're doing this, are you adding more bend to the knee?
No, whatever is comfortable for you / comfortable for them. Yeah, the knee stuff won't make much of a difference. The only thing that could be a factor here is that if their quads are super tight, knee flexion will be limited, and you may see their pelvis kick up. I have a feeling that she may be able to represent that for us, so let me show you that here in just a sec. That's where I get the stretch. But if I do this, let's see. See how there's a pickup here? That tells me the quads are tight. But I can't work on that in this position. I gotta see that, go, ha! One, that's limited. That's not far past 90 degrees, right? That's limited. That tells me the stuff on the opposite side is too tight, and especially tells me that it's also affecting the hip and the pelvis. So I know I need to get that in supine. All right, hamstrings. All this should start with, you're gonna have to do that anyway, because you're gonna palpate a little bit without applying lotion, then you're gonna apply a lotion, get that distributed, and then you'll be going in with the forearms. Is ideally your first option. So on an angle, cross. On an angle, cross. On an angle, cross. On an angle, cross. Push, pull. Push, pull. Push, pull. Push, pull. Good Drake. Heel squeeze. Push, pull. Squeeze. Heel squeeze. Push, pull. Then I'm here. Little rock. Okay. Get your feet up, please. All right. And then let's turn you on to, let's let them make the decision. So watching the tenting, make sure at the very least this sheet is all the way covering the upper part of their arms and shoulders, okay? If you have to, turn them into a ghost. But you, this at least, you're safe, okay? Pinning with my leg, I'm standing more in line with their hips. Arms pretty far apart, I'm not like this. And then holding it taut that way. Okay, go ahead and turn. There you go. Now, this is where I gotta check all the marks. Now she turned this way, so I'm gonna just do for efficiency's sake, get the bolster in there to start. Okay, knee up for me. People will get confused as to which one, so I tend to just tap. I say this leg up on the bolster. Make sure they're unstuck. Come all the way around. The rest of this I want to do from this side, okay? I want to stand behind them while I do the rest of the draping stuff. All right, first one's going to be, she's far enough back for me. That works pretty good. I have to remove that towel, please. Scoot that out. Great. And I'm going to throw that right over top, like so. I'm going to take the face cradle and the pillow. You don't have to use both. Head up, please. Great. And then this is where I reach across, find the corner of the sheet. Head upward, please. I'm going to tuck this find it underneath your head. There we go. Now, we show you that, but I tend to just rely mostly on this. All right? Okay, now I'm going to ask, I have this blanket or this towel on top. I'm going to have you bring your arm out on top of the sheet and underneath the blanket. It's not perfect, but as long as I stand here, I have all that extra coverage, we're good to go. All right, now we're all set up for the rest of it. She's far enough back here. Pillows, bolsters, towel, sheet, we're good to go. All right. Now, working up at the head. Good place to always make sure you re-sanitize. Okay. Just contact the scalp. You'll know you're covering all areas if you just kind of think, all right, both thumbs come on an angle in line with the ear, right to the earlobe. This hand's going to be right on the temples. This hand will be on the occipitals. And we could either use fingers like this. If you are inventive and brave, you could use a palm like that. This works perfectly good. I even do stuff like this. I get away with this, but look at my body mechanics. So if you saw me just doing what I actually do, if it doesn't feel good and work for your body, don't copy that. If you're ever watching anybody do a demo, doesn't mean that their goals and their ability to create an effect isn't great. But you got to find ways to adapt and cause the same effect. Maybe you have to do one muscle and then another muscle. And you're going to get the same effect. You just do 2 applications instead of 1. Okay? Now, this hair is already out of the way. That's helpful, but I'm able to kind of draw up if I had to. Pin the hair. I'm going to follow the neckline right into those first 2 ribs. Note I'm not standing like this. Standing behind the head a little bit. The upper traps and levator scap are posterior, more posterior. They're not perfectly lateral or anterior. So, not here, here. It's a tiny adjustment. Contact with the neck. Can't miss that. Upper trap, levator scap. So kind of more right into the ribs and then across. So in this case, instead of going with the skeleton, it's more like we're pushing into the skeleton and then across. Then I can stand right here, bring my forearm up to the neck, and I'm right in the perfect orientation. I can be lower, thinking the lower half of the cervical spine, then the middle section of the cervical spine, and then the upper section of the cervical spine. The additional application would look like this, with a palm. The goal would be kind of this, where my palm finds the base of the skull, but I want my pressure to be between the skull and the first 2 vertebrae. So I'm not up here on the occipital bone. I'm here. And that's what my forearm is going to do. And that'll become more important when we get specific to like neck related issues. But these two orientations, I'm getting on just about all the muscles of the suboccipitals, and then there's other more superficial connecting things. There's a lot of stuff, a lot that comes up and connects under the base of the skull. Okay. Now, this is why I love using this towel. It's because all I have to do then is bring this up. I have all that extra coverage across the chest and the sheet. Now I can start navigating this. I could drape or do it over the sheet. Not a big deal to have to go over the sheet here. But drape, towel holding it down. Okay, there's the scapula. There's the medial border, there's the lateral border. All right, now it's actually gonna come up here. So the seam of the shirt is gonna help me. I gotta start way up here, and I gotta try to be over that lateral border. So I can't be like this. Now I'm on the scapula. I'm gonna be over top. This is where I might need the step stool for to lower the table. So look at where my elbow is. Like the line of my elbow is in contact with her arm. Okay, now I do this, but you can just rest their arm on top. I'm gonna show this option now just because one of the few things I guess I actually invented.
So on Seymour here, would the scapula be turned? So like you're not on top of it, you're more on the ribs? correct?
Yes, exactly.
So you're
Exactly.
not gonna really feel that boniness.
You should
more
feel like you
on
maybe
the
have to go right over the lip of it. But yes, so what you may have to do with a client is if they're rolled too far forward on you, you might have to ask them to roll back and be more
Like
on their
that
shoulder.
turn. Gotcha.
So then, my hand is up here on the acromion, and I'm just gonna push towards the pelvis, and then let myself kind of do a little bit of a side bend. It's not perfect biomechanics, but I'm just gonna let gravity take me towards the spine. No, not gliding. Just compression plus a direction. And my palm here helps me know where that scapula is. Down towards the spine. Down, and then I could hold this for longer if I had to. Say, okay, good deep breath. All the way out. Okay. Good deep breath. And all the way out. Now I'm getting multiple things. Shifting the scapula, shifting the ribs. Okay. And that's all we need to worry about there for now. If there's more stuff going on, we'll eventually be able to get to it. But that's a essential thing to get comfortable with. With almost anything related to the shoulder, that area does not get addressed nearly enough. And it's really, really important. Okay. Now, what's cool about this set of applications, right side of the body, right forearm, right forearm, right forearm. Find the top of the ilium. Really easy. But I'm not going to push into it like that. I'm going to find it, and then I'm going to try to drop straight down. And then this is where we can start chasing a symptom. I could ask a client, does it feel like it's more in this area? As I'm tracking more anterior, I'm like as lateral as I can be, and then I'm going towards the abdomen. Or I could start tracking outward, more posterior, towards the spine.
But you normally would start right in the center.
Yeah. I feel like that just kind of works in this kind of pattern a little bit better. I can do all three like that. Even if this was just a generic relaxation massage, this might be all it looks like. It's kind of hold here, kind of hold their traps. Non-specific, just making sure I cover the area. With these three applications, it's real subtle. I've done one straight down. I'm going to step further back, increase my elbow angle here, and then I turn there. That's going to get three key aspects: the lateral side of the low back, stuff more related to the lumbar spine, and stuff potentially more related to the sacroiliac joint. So, huh, huh, huh. But you can't do this gracefully if you can't visualize that or recognize what you're feeling as you work around it. Because a lot of times you're using the skeleton to guide you. And as long as you're in these particular regions between two bony structures, you're hitting what you need to, even if you don't know exactly what those muscles are called. So, all right, done. For hip work, pretty easy. There's the greater trochanter. I just have to draw a half moon shape around that and compress everything. So this isn't in the listed protocol, but that's all that would look like. Not too bad. Much easier when you're higher up though. So if I have a step stool, come more straight down, all of that. So you can work on all of those muscles, including the deep lateral hip rotators, inside lunge. All right, scooting the leg back a little bit, making sure sheet tucked between the legs. And this is an example of over the sheet, right? Rather than trying to drape like this and get really refined where I create this sharp line, I'm gonna let that stay bunchy. And I will nudge the sheet with my forearm. I don't need to fight to make that line already. You can kind of just nudge that bunch of sheet with the forearm and it will move. So here we are. Hamstrings, adductors. Hamstrings, adductors. Hamstrings, adductors. AD. All the way up. And if I had to, if there was something more specific going on, like somebody strained their hamstrings, then I could just bring the sheet down and go right over top of it and incorporate some joint movement. Okay. Gastrocnemius. Around, there's some deeper muscles. Underneath gastrocnemius is a muscle called soleus, known as plantaris. And then deeper to those three muscles become the Achilles. Deeper to those are three muscles that come down and work at the ankle and your toes. And they go right through the tunnel. Here, if I can find the calcaneus and that medial malleolus, that big bony bump, that's the end of the tibia. That's where those muscles go, right into the arch of your foot. So I'm feeling for that, felt for that malleolus. There's that calcaneus. I know if I work along that line, I'm helping those tendons. Okay, hand underneath foot, forearm, and you can't go wrong here. The only things you're avoiding here is regressive pressure, like right into the calcaneus, and where that joint line of the first phalange to the first metatarsal is. People call that the ball of the foot. You don't want to apply pressure right there. It has these extra little bony bits. If you look on the skeleton, there on the big toe, has two little sesamoid bones. And it acts as like a track for the tendons that go down there. You don't want to push right on those. But everywhere else, you can compress and it's good. So you'll feel that. It'll feel bony. You just are only avoiding that part. Everything else, you cannot go wrong. Okay. Redrape. Okay, you'll see this better when it's on the other side, but draping here, make sure you take that sheet and you bunch it right against their leg where before you start moving it up. Okay, I can visualize IT band. If you look at the charts, you'll see that's kind of this white triangle on the outside of your leg. It tapers at the knee and then gets wider up at the hip. I'm going to try to visualize the line that it has on the anterior compartment with the quadriceps and then the posterior line it has with the hamstrings. I'm going to want to go,
With the white strip.
yep, that white tarp. So I'm going across that line and then I'm going with that line. Beyond thinking about the skeleton, when you're looking at those muscle charts, that's where my brain really goes. I think about the skeleton, sure, but I'm thinking more about the compartments of muscles. There's like a posterior compartment on your leg. That's going to be the hamstrings. You have a lateral compartment. That's the IT band. Then you have an anterior compartment. That's your quadriceps. Then you have a medial compartment. That's the adductors. I try to visualize those lines and make sure the lines where they overlap or connect are pliable, so that all those groups of muscles can function appropriately. If they're stuck to each other, when one tries to function, then it's pulling a bunch of unnecessary weight. Okay, down here, the lateral side of the lower leg, really important, and then the anterior section. There really isn't anything aside from this stuff on the medial side. The rest of it's just tibia. So the way I can work on all this, it's going to look just like how I worked here. Here, I'm working on the anterior compartment. Here, the lateral compartment. Stuff closer to the tibia, stuff connected to the fibula. Muscles of the tibia, muscles of the fibula. Muscles of the tibia, muscles of the fibula. And then my favorite place to knead ever, because this palm can rest just lateral to that tibia, and this orientation will feel like you're just above it. This hand can come over and grab all of those muscles on the back, and you can get them all. You can get basically every muscle of the lower leg affected right here. It has to be big, see? But boy, does that work good, and I think it feels spectacular. Okay, hand underneath. I do that more gracefully, you know. Usually like this. I usually have my hand here for all of this. I'll kind of do some stuff like this, and then hand underneath, and then we're here. I'll get to showing how there's all the joint movement stuff snuck in. But incorporating as much joint movement into your massages where you're going to get a lot of secondary benefits. Kind of like when we were talking about how we could affect digestion, right? We're going to get a lot of other benefits for fluid movement dynamics, blood and lymph, by just moving the joints. Okay, so now I'm going to get that sheet. We're going to tuck you back in. See how using that towel makes my life just so much easier? Okay, sheet is up over the, touching the neck. Reset this. Okay, now I gotta come around, get the bolster. So knee up for me, please. Great. And then I'm gonna grab and then go ahead and turn on your other side.
I tangled myself.
Oh,
There
it's
we
okay.
go.
Inevitable tangle. Okay, screw just a bit back towards me. See how, like, if you can just start checking all that immediately, then you won't get caught. Oh, okay, I was wondering what that was. All right, top leg. Yep. Untangle. People will get twisted. Don't be overly delicate, right? You know, don't be cruel, but untuck. There we go. And then here's where we could do the quick tuck here. Done. Doesn't have to be all the way underneath, just a little bit. Again, I rely almost entirely on this in real life. Okay. And I look for their shoulder, their elbow, and they can get their arm out. Tuck that more underneath. And just having this here as a safeguard, you can't beat it, so do it. All right. And then here, a little sanitizer. I don't think that's good hair gel. I heard one interesting horror story of like somebody having a therapist do the whole massage using sanitizer instead of lotion. Yeah, I guess it would kind of work, but.
They didn't have to take a shower when they got
I
home.
know. So showing how I could use more of the stacked hand approach for all of this. I'm trying to move as much of the scalp as possible while also concentrating on particular muscles. There's this option for doing stuff like that. And then there's this one. So, get to pick and choose whichever one you like the most. Or I think, as I demonstrated with some people last week, you could have them feel and just tell you which one they like and go with that one, right? But you need to think about what's most comfortable for you, what flow is best for you. Okay, contact, right into the upper trap part. We've already worked on this area once. Remember in prone, how we had pulled? So we've already kind of warmed the area up. Here. More directly into the skeleton. And then across. Up to the cervical spine. Lower cervical. Mid cervical. And upper cervical. Loose hand. Good. And I'm standing right here. Swoop up. And you see me ever do this glide in a demo, I'm just contacting skin. I'm just doing this to make it feel nice. So no pressure, just gliding on skin, no pressure, no pressure, no pressure. Then here I start applying pressure. I find the base of the skull. I orient myself accordingly. I'm more posterior right now. And I take a step forward, I'll be a bit more lateral. And then I'll get a bunch of different stuff. If you look at the structures of the skeleton, back here I'm hitting the stuff more kind of where the spine meets the base of the skull. Versus here, I'm starting to get close to that mastoid process, that big bony knob right behind the ear. So I'm getting completely different muscles by just doing this to that. Cool. All right. Now I just have to bring the towel up, grab the arm up, make sure they're rotated enough toward you, elbow over that lip. Then I do this, but it could also just be this. Okay, this hand on the acromion, and then right there, I'm feeling with my elbow to make sure I'm over the lip of the scapula, over that lateral part of the scapula, more on the ribs, and then down towards the spine. Down towards the spine. Finding a thing, down with a bit of a hold, good deep breath. All the way out. Okay, big deep breath. And I'd probably do a couple of those if I felt like it was necessary. I'm showing a little bit of how I actually work. Like I keep my eyes closed almost the whole time. And I'm just feeling. Like I'll make sure I know where that, but I end up being like this the whole time. But I can feel where the iliac crest is. I can feel where the ribs are. So I know right there's where I need to be. Track a bit more anterior. Work my way more posterior. Rotate my arms so my elbow's more towards the SI joint. If we were going to work on the hip in this orientation, greater trochanter, or it could be this other arm. I've used either or. depending on the circumstance. Okay?
Finally got it in my head to use the left arm for that side. Now you're switching it
Good
up on
job.
us.
Yep. I know. Well, that's the only reasoning there actually was to just hold greater counter pressure. The only reason. But otherwise, I mean, I'm going to get that stuff in prone and certain. So, all right. Here, big bunch. Hamstrings, adductors. Hamstrings, adductors. Hamstrings, adductors. Hamstrings, adductors. And if I have to, over the sheet, hamstring attachments, I can incorporate a little joint movement. Okay. Then, gastrocnemius. You could do that in either direction. You'd be totally fine. Maybe both directions is good if the lower legs are the area that their primary goals are associated with. Okay, cradling the foot, forearm. Good pop.
I needed that one.
That was
Got a couple down there.
That's where a pop can happen naturally, and it can be a very good thing, but it's not like that was forced, right? Okay, this is where that draping is essential. Bunch, 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 then crowd. Okay, then I'm here. IT band. Cross that. Oops, let me scooch up a little bit. Some people make this really graceful and it works good for them. It's not one that has ever been my favorite. I'd rather rotate the leg in prone and supine. So, you gotta know how to work on this area in the event that you get limited in sideline, right? That's just essential for a lot of things. Not specific to you, but it's like anything. Anybody that has to lay on their side predominantly in the session still want to be able to cover that area. Okay, here we go. Tibialis anterior, extensor digitorum longus, fibularis longus, extensor hallucis longus, fibularis brevis, and on the way you go. Push, pull, push, pull, push, pull, pull, slip, push, pull, here, hand under, hand on top, and done. Okay. Now, we'll get knee up, please. Good. Okay. And this one's easier because I can just hold on to the sheet like this. Should have got her tucked back underneath. Very good job, client. Okay, and then turn onto your back. And I'm going to remove one pillow. Bolster underneath the knees. There we go. We don't have to worry about the lower leg anymore. We're just worried about the upper leg. Okay. Toes are to the ceiling. Maybe I could start like that. I could go across. I'm thinking more just the anterior portion of these upper leg muscles. Then I roll the leg in like that. Make it all feel like and look like it's part of the massage. But these first parts, we're just getting it rolled in. You know, the toes are on a 45-degree angle. This is how I prefer to work on IT band. And then on the in prone, I do a similar thing. But that's my personal adaptation. Okay? And if I turn the leg out like that, I'll hold the knee. kind of cradle it like that. This is, you're going a little bit downhill, but don't like wrap your elbow all the way between the legs. Like you're just trying to get this section. Think like the patella is the line in between. We just need to be a little bit medial to that. So I just need to be here. Don't need to be doing this. Just here. Okay. Then, from here, I can find that real easy with my forearm. There's the anterior superior iliac spine. Over here would be the greater trochanter. So see how I can palpate with my forearm? Not even searching for stuff with my fingers. There's the anterior superior iliac spine. There's the greater trochanter. I need to be right there. Compression straight down to the table. Little nudge. A little bit more lateral. A little nudge. Or with any of this, just ask the client. Go ahead and rotate your leg. And come back. And again. And good. Good. Retrace. And do that all again. What, we got some asymmetry. Okay. The interior. This quad certainly feels a little bit when there's more going on. So go ahead and extend your knee, flatten. This is where I just would incorporate some active movement stuff. It's not very big, just having her push the back of her knee down to the bolster. And relax. And then again. And relax. That's just contract, relax. Where I push on a muscle and then I have them short while I'm compressing. Okay, interior section done. Rotate the leg in. Lateral section. Rotate out. And the medial section. You could do that in any order. I think I tend to be more, I think I just change it up every time. I don't know.
Now, when you do the legs, it's more kind of like 12 o'clock and 2 o'clock with your arms.
Yeah,
Yeah.
yeah, that's pretty good. Yeah. Maybe even more like a 1 o'clock, like a 12:30 or a 1 o'clock, but yeah. Just not too vertical, but yeah, no, that's a good orient. Yeah, thinking about clock face, the clock dials, that's a good way to think about it. Okay, here, passive movement is just pushing on the outside of the leg. As long as I see the toes moving, I know I'm moving the whole leg. I have you rotate here. Okay, good. And let go. And again. Good, relax. Okay, coming a little bit more lateral. Okay, again. Good. And again. And good. Okay. Reset. Coming all the way up. I'm going to work on the non-dominant arm first, if I can help it. I find their wrist first before undraping. And this towel can further help holding the sheet down as I'm looking for access to just a tiny portion of the chest. So contact with the table. Forearm right there. And then rotation. If I needed to make this more, I can let the elbow straighten and just try to kind of rotate the whole arm over. Okay? And I'm standing right here. Now I can use this instead of kneading. Just warming everything up. Then this is how I use, instead of doing the forearm like this, I tend to use my palm here. But it's the exact same action, basically. There's a glide. See, I can follow that glide, but I keep my body moving while I do that. Push, pull. Push, pull. We do a few sets of that. And come down. Squeezing the metacarpals. First, fifth, second, fourth, third, first. And set. Come around. And all over again. Here, here. Make contact with the table. Forearm over. I do have to kind of do a little bit of a side bend. Where I have to have my body mechanics be perfect 95% of the time, so I can get away with these small adaptations. If I need to make that more exaggerated, then just like this. Just getting a few more rotations for her so they can feel like mine is adding a little bit in there. Okay. And push, pull. Push, pull. Push, pull. You need to go with the line right there. Or it could be a forearm. And down. Around the area. Palm near the elbow. And here. Now, this would be a little bit what people call myofascial release. I'm just getting the skin, moving the skin to where it stops. That's called bind. And then I patiently wait. And then I am gliding, even though it might be hard to see. I'm moving out of the way for the camera. I'm slowly at a snail's pace, moving along. See, now we're getting more of a glide. I have to be patient. And the mechanics of this are no different than me having to just hold a really long compression. And I'm just changing where I stand so that my shoulder and my palm are lined up correctly. Push, pull. Push, pull. Push, pull. Push, pull. Just doing a few more rounds here because we can actually see it with the camera. Okay? Working my way. Thumb, pinky finger. 1, 5. Index finger, ring finger. 2, 4. Middle finger, 3. Thumb again, 1. And good.
Do you
Right.
ever do any supines with your hand facing up versus down?
Sure, but I mean, just you would have to do mostly using your hands, your fingers to pull that off. Or I could maybe do something like this, but it's
But I mean, like when you're doing the forearm and stuff like that, like it makes more sense for their hand to be down, right? You want those.
they'll tend to roll out like this on you. Is the issue. That would be anatomical position, and if I could, yeah, no, perfectly okay to do it that way. Interestingly enough, what you're asking, I do that in prone. I'll turn the arm over in both directions, and I tend to get both sides of the forearm actually in that position, and I do way less in supine. But yeah, right here, as long as I stabilize that wrist, I can totally.
I just wasn't sure if like you were trying to aim for a certain muscle, if it's turned one way or the other.
Oh, sure. But I mean, if we're thinking about that action, pronation and supination, like right there, I can get, if I pin here and do that action, getting the posterior muscles associated with that, that'd be like supinator. I turn it over, I pin and do that action, now I'm getting pronator. So yeah, if somebody had more going on there, then it's certainly something that I've gone after. I think your cosmetologists or fellow massage therapists, their forearms can get really, really rough. Dental hygienists too, mechanics, everybody. So here is where I gracefully, let's see, lift the head up, okay, head down. Let me see if getting the ponytail in a comfortable spot as possible. Is that okay?
Oh, yeah.
Okay. So seated is where just if you use a soft fist and make sure you're touching the table, you can't miss. And this is the good side and the bad side of the rolly stool. I kind of have to hold on to the table to keep myself from rolling away. So that's where a chair for some people works better. I tend to do pretty good by just anchoring with this foot. Okay, then the hand underneath, thinking the other side of the neck, so I'm on the left side of the neck with my fingertips. That's where I could do a lot of good work here. Trying that on the other side. Just balancing out with soft fist. Okay, then hand underneath. You see fingers. And curl. Now that could be more broad and kind of gentle, kind of trying to pick all the tissue up like cat, nape of the neck. Or I can curl more and get real targeted on those muscles right by the spine. But usually that's what feels really good. And just small little compressions, tiny rotations. Like notice I'm not taking the neck and cranking it all the way over, or anything like that, right? Okay. I have one more thing I do here that people tend to like. It's a mild traction, okay? So don't be trying to do it this way. And if you're gonna do tractions in the neck, you wanna make sure that their head doesn't end up with their chin up. Okay, they have to have the chin down a little bit. So I'm gonna do a little bit of a scoop. My hand's gonna be doing this underneath her neck. And then I'm just gonna pin my elbows against the table and lift my hands up, and that'll create the traction like that. There's other ways to do this, but this is the one that I figured out the best, so I kind of swoop in. So thumbs on that side, you'll see the thumbs on this side. Plant both my forearms, make sure I'm not on hair. Plant both my forearms, and then just lift my hands up. Tuck the hair a little bit there. And just relax. Hair swoop. This is usually the pattern I follow. I get the hair out of the way so I don't inadvertently pull on it. And both hands placed underneath. Make sure their chin and nose are lined up with their sternum. And then see how I'm just pushing my arms into the table. Magic. And then just slowly but surely I'm gliding up the neck. And I'll do a little thing with the thumbs. Just you can do a couple rounds of that, but people tend to like that one. And then for the rest of the head, just above the eyebrows, squash. And then away from the midline. The squash, and then if I do anything also, kind of pull up towards the oh, the cranium is a powerful thing. Holds the most important part of your organs, that brain. So you'll see that in a lot of systems where there's this kind of either non-contact or contact. Usually the person's paying for touch, so. And that's my pattern for night. Then this is where how I cycle it. So you can do the abdominal work before or after, whatever. But then this is where I go, okay, we're gonna get your knees up, feet flat. We'll do one more thing for your low back. your hands kind of there. Now I'm gonna show the lazy version of draping this to start, and then I'll show the advanced. It's not that advanced, but if you're just in the room alone with them, right? I don't have eyeballs over there. I'm here. So creating a little window here isn't gonna, the perception's not gonna be particularly invasive, right? So then I just have her rotate her knees toward me, hand goes underneath, hold, and pull. I do pretty well with one arm versus two. You see how elbow's straight, and I just hold on for dear life and say, okay, turn the other way. And then if we had skin contact, I would just be gliding. Right now, with more of a hold, I'm probably getting more of a direct stretch.
Mhm.
And then come back toward me. Then I would reset my hand, again, closer to the spine, big pull, and turn.
Do you see more of a benefit them doing it themselves versus you pushing underneath?
It tends to be better if they do it. If we're looking at terms of like actually creating therapeutic change qualities in the body, active movement incorporation will always be more effective because you're interacting more with the nervous system, which is actually what's controlling the tone of everything. Then standing here, I tend to get one side of the abdomen with that pressure contact, where I'm following that rib line. So not the xiphoid process, but I'm just gonna dent that rib line and then tell her to take some nice breaths. Not huge, but just good breaths. About 2 breaths per spot. Based on the anatomy, I tend to know that where rectus abdominis, your six-pack muscle, sits over top external oblique, tends to be something hiding there if there's gonna be an issue. That doesn't seem too bad, actually.
No.
There's a thing, but this has a different sensation to it. So it'll be important for you to feel this because it won't feel like somebody's working on your belly. It'll feel like it's more associated with like a muscle attached to your ribs, okay? So,
Do you just keep pressure, or do you like move your fingers?
I just keep pressure. And then that's a good point. Sometimes there is a little bit of a, and I sink in and I'll just, tiny little adaptations tending to happen a lot. They're real subtle. That'll kind of come as time goes on. That's me chasing where it feels like the connective tissue is binding. I'm always looking for where stuff feels like it won't move and trying to kind of remind it. Like, hey, go that way. All right, they're doing better. Now, hey, you go that way. And that ends up looking like pressure, and pressure, technical terms. Now, showing how we could drape this to get more directly onto the abdomen. All I have to do is ask the client to hold that towel and look. It's not the hardest thing in the world. Done. So it's really not a big deal. Right there, good, you can just relax. And then we would have more skin contact. So if we were gonna do more work here, like I could do some knees and everything like that. But to introduce people to this concept is kind of, I tend to stagger that a little bit. So I go, all right, knees toward me. And I come all the way over. Then, all right, knees the other way.
Do you want a kind of glide with that, or is it?
It doesn't have to, and if I did not want the glide, which will concentrate and create a bit more of like a lumbar twist style stretch, and come back towards me, then maybe I would just go over the sheet. But the glide feels better. Okay, go and turn. You just hold on. Good. Anybody with low back issues, this occasionally can really feel fantastic. And they can kind of challenge it to what feels comfortable and correct for them, right? And then here I'd find that rib line and push in. Some good breaths. Now, if I had done this first, then I could just do this. Take the sheet, put that right over top of everything, and then it'd be, put the bolster underneath the knees, do the whole thing, and into the head, and be done. One last active movement piece that I tend to throw in, I'm just gonna show you as a nice thing to throw in the event that you have somebody that, a textbook reasoning for this would be blood pressure medication, right? We have them do the active movement and rotation, and then I have them do one more thing where this is correlated with a lot of your balance muscles. It's all the muscles that are your adductors and all your muscles that are your abductors. And those are the muscles that keep you from falling side to side. So your balance reflex ones. So there can be the person has issues with balance, they're a more frail person, and I want to make sure that I'm encouraging their balance muscles to be more activated when they get up off the table, or for dizziness, blood pressure reasons, okay? So I would have you bring your hands out and do a little prayer hand. She's going to push her hands together, that's activating upper body adductors, and then push your knees together, lower body adductors. Good. Now you're going to clasp your fingers together, pull apart, and pull apart. Okay, and again, push together, and push together. And good. You could do a few cycles of that, of course. And there's a whole lot of cool reasons. I gave you some good ones, but there's even issues there where the pelvis had some alignment issues from either the pubis symphysis, where the bones come together. You'll see the cartilaginous joint right there at the middle, right? That could shift in a good way, or it might even affect the SI joint. So kind of a thing that I just tend to sprinkle in. We'll come back around to that when we're looking more at like gait reflex and pairs of like neurologic pairs throughout the body, kind of a thing. But now I've woken them up, and I can say, all right, I'll meet you outside with a glass of water, and we'll get you scheduled for next week. And away.